Ladies and gentlemen, welcome to the American Healthcare Association press conference. There will be a Q&A session at the end of the program. At this time, I'll turn the call over to Beth Martino. Ms. Martino, you may begin.
Thank you. Good morning, everyone, and thanks for joining us today. I'm Beth Martino, the Senior Vice President of Public Affairs with the American Healthcare Association. We're looking forward to sharing with you some information about what's happening in long-term care facilities at this point in the pandemic. This morning, we have Mark Parkinson, the Chief Executive Officer of AHCA and NCAL, and we will also have Dr. David Gifford, our Chief Medical Officer, both providing updates. And at this point, I will turn it over to Mark.
Thanks, Beth, and good morning, and thank you for joining us on what is both a somber moment, but also a point in time where we can have some hope. And the somber moment, of course, is that we're here marking 1 year since COVID-19 found its way in a big way into long-term care facilities, and what a tragic year it has been. By far the most difficult year in the history of the long-term care sector, for the simple and just almost unthinkable reason that over 170,000 of our residents have died in our buildings over the last year. Our thoughts and prayers go out to all of the families of those that have been affected, the relatives, the friends, the loved ones. Behind those big statistics, each person has a story to be told, and our thoughts and prayers go out to each one of them. Over 1,000 of our caregivers have also died, and our thoughts and prayers go out to them and to their families as well. It's just been a tragedy on every conceivable level, both in terms of the numbers of deaths and folks that have been impacted, but also through the work that our caregivers have undertaken. Our courageous caregivers have continued to work in our buildings day and night, 7 days a week, through very difficult circumstances, often not having all of the supplies that they've needed to fight this, and really showing great courage. But they're tired and they're exhausted because it has been such a very difficult year. Now, there is good news, and that news is that this nightmare may be ending. There does appear to be light at the end of the tunnel, and that's because cases and deaths in our buildings are declining, and they are declining dramatically. The data is extremely encouraging when you look at what's been achieved. The latest week of data indicates that since the peak of cases in December of 2020, when we were having over 30,000 cases a week, we've now had an 82% decline in the last 7 weeks. In the last reporting period, which was the week of February 7th, we were at 6,000 new cases, which is getting us to the point of the lowest number of cases since the government started collecting this data clear back in May. And really interesting is that the rate of decline is actually more significant than the rate of decline in the general population. When you look at this time period between December and now, we've seen an 82% decline among residents, a 78% decline among staff, and quite interesting, a 46% decline in the general population. Now that alone is impressive in the general population. But the fact that the number of cases has been declining more dramatically among residents and staff is a really good indication that the vaccine program is working, because of course our residents and our staff were among the very first to be vaccinated, and these case numbers are very encouraging. The most important statistic, though, is in terms of deaths. And again, we are seeing the same pattern of a dramatic drop in deaths since the reporting period on December 20th. Specifically, we've seen a 63% decline in deaths since that time period, now achieving to the point where we're at 2,000 deaths a week, which is still way, way too many, but significantly better than what we experienced back in December. Because there is a lag time between new cases and deaths, we are optimistic that this trend line of drops in deaths will continue, and that in the not too distant future, we will have very few new cases and deaths in long-term care facilities. It is obvious that the vaccines are working, that the decisions that have been made to prioritize residents and staff for vaccines were good ones. And now we have even more encouraging news. with the Johnson & Johnson vaccine being approved just this last week. At this point, I want to take a brief moment to congratulate the governors and the states. Clear back in November and December, we were advocating that the CDC place residents and staff at the highest priority for vaccination, and the CDC did so. That, however, did not guarantee our prioritization. That was ultimately a decision that was left up to the governors. Fortunately, it appears that every governor in the country placed nursing home and long-term care residents and staffs at the top priority for vaccinations, and that has proven to be a superb decision. We challenged the nation's governors to have the second dose, the second clinics in facilities by March 1, and fortunately, it appears that they have achieved that goal. We have now at a point where over 4.6 million residents and staff have received their first dose, 2.5 million have received their second dose. And with respect to the goal that we set for March 1, the data indicate that that goal has been achieved as well. So again, our hats are off to the governors and the states for following through on the goal that we had set to have this work completed by March 1. The vaccination program is not fully complete. There is still work to be done. We've seen tremendous uptake among residents, but we still have some work to do with staffs. There will be new residents and new staff that will need to be vaccinated as well. So it is incredibly important that we continue to keep our focus on this program, that residents and staff continue to be at the highest priority, and that the states and that the federal government stay vigilant in making sure that adequate supply and administration of the program can continue to run smoothly. At this point, I'm going to turn it over to our Chief Medical Officer, Dr. David Gifford, who's done a terrific job in leading our vaccination efforts, and he can talk with you about the successes that we've been able to achieve and the work that we still need to do. Giff, I'll turn it over to you.
Thanks, Mark. You know, as Mark was saying, we set a goal to get everyone in the nursing homes vaccinated by March 1st. And what you can see is that everyone has completed at least the first clinic, and the second clinics, as of March 1st, almost 100% are done on the nursing home side, and 75% done are on the assisted living and other senior setting sides. Actually, 2/3 have already finished the third clinics, and within the next couple of weeks, we expect to see close to 90% or more having had their third clinics with this. This program and partnership that the federal government set up with CVS and Walgreens really is short of nothing but an amazing feat, that there were 15,000 nursing homes and over 30,000 assisted living that literally within a week of getting approval, they have been able to, over this short period of time, 3 months or 2.5 months actually, get vaccine out to all the residents and staff out there. That is just an amazing accomplishment. And we're very thankful for them for making this priority, because as many of you have reported, the number of cases and deaths in this country that come from the long-term care, nursing home, assisted living can be as high as half of them in many states. And so this really is the ground zero of where we need to tackle this issue that's out there. We have been looking at the data on the vaccination uptake rate, and amongst the residents, we're seeing close to 80%. That is similar to what was reported by the Center for Disease Control after the first clinics that were out there. The staff, it's been a little bit lower. They tend to be mirroring what the polls show of the general public, wanting to take the vaccine, wanting to wait and watch and see how things go, since they were really the first group to get the vaccine. And so we're seeing after the first clinics, right around 40% uptake. CDC was reporting 37% uptake, so it matches it pretty closely. That's been increasing after the second, and we expect to see it go up to the third, but we want to see it higher. And so we announced a goal by the end of June that we'd like to see at least 75% of the staff vaccinated out there. That's higher than any other setting that we're aware of, higher than what we're seeing in the hospitals and other settings on the vaccination rates. But it's really going to be needed to do that, not just to protect the staff, but also to protect the residents and allow us to move into reopening out there. And I think that has probably been one of the most devastating things that has happened with this COVID outbreak, is the fact that family members, friends, relatives cannot visit their residents in long-term care settings, so we could try to prevent the spread of this virus out there. I think it's time, as we get everyone vaccinated and we start seeing this, it's time to reopen. It's time to allow visitation, time to let activities occur. Frail elderly, when you keep them in a room and don't allow them to move around, that's not good for them. It's not good for their mental health. It's not good for their physical health. We need to get back to working in that area. Though we need to do it safely and we need to do it cautiously. And I think that's why we've set this goal of 75% vaccination rate, because we're still in this transition period. Many of the family members and visitors haven't had access to the vaccine yet in their states. We're encouraged with the Johnson & Johnson becoming available and encouraging people of all ages to get vaccinated, because that's what's going to take to prevent the spread of this into the long-term care population and allow people to really reopen on a regular basis. This next phase, CVS and Walgreens, we're working in phase 1 to do 3 clinics. As we said, those 3 clinics are finishing up. Now the challenge is how to keep that momentum going, and how do we get vaccine out to the nursing homes and assisted living facilities. There are 3 ways that the federal government is set up. One is to use the existing long-term care pharmacies, that they get their normal medications and flu shots every year, and that the federal government would set aside some vaccine for them to order. We are looking forward for them to launch that program and get that going, especially as everyone winds down in the 3rd clinics. A number of states are also working with long-term care pharmacies and taking some of the vaccine they get from their federal allocation and making that available to nursing homes out there. And we're encouraged by that process. Though we need to, again, make sure that we remain a priority as they work towards opening up all the other clinics out there, that we don't slip by and everyone sort of moves on and leaves us by the wayside. I think we really want to encourage states to continue to keep us as a priority in enrolling pharmacies and getting the vaccine available. And then I think it will be transitioning to also, some states have some unique programs where they're working directly with the pharmacies or have their own vaccine providers that are coming out and vaccinating. We really are agnostic to any model. The real issue is to make sure that vaccine is getting into the arms of the staff and the residents that are there, as well as the visitors that are coming in, because that's what's necessary to keep those numbers that Mark went over low and continuing on the trajectory we are, because I think that really is the light at the end of the tunnel. And it's so important because, as many of you have reported, the number of cases and deaths from long-term care can be up to half of all the deaths that you're seeing in states. And if we really want to prevent that and prevent any other waves from coming back as the new variants spread, we need to continue to make sure that long-term care has access to the vaccines, to PPE, to testing out there, and to staffing. This has been a devastating time to the staff as well. Many of the staff treat the residents as family members, grow very, very close to them, particularly a lot of the residents who don't have family members or family members are far away and can't visit normally. And it's been traumatic to watch the number of people suffer through this. And it has taken its toll. A number of people are, it's reaching out to wanting to leave and impacting them. It's having trouble recruiting new people. We need help in addressing staffing issues in this sector if we're going to keep fighting this COVID as we go forward. And then lastly, we continue to advocate to CMS and CDC, who write the regulations and guidance that we follow, to look at the data on the dropping cases, look at what's going on out there with the vaccine, and determine when it's safe to reopen and when it's safe to get back to the activities, and to do that as quickly as we can, because that's really necessary for the health of the residents that are out there. And then lastly, this has just been devastating with all the increased costs for testing, vaccine, PPE, the drops in admissions and revenue. It is severely affecting the overall functions of the buildings. And there's no way we could have gotten through this last year without funding from Congress, and we applaud them for that with the Provider Relief Fund. But that is only going to carry them so far through this year. And we're already see that effect in a number of facilities, and we need additional funds allocated from the Provider Relief Fund to make sure that this industry doesn't is able to continue to fight COVID as we go forward with this. Mark, let me hand it back over to you.
Great. And I think at this point, we're going to turn it over to Beth, who's going to moderate the questions.
Thanks, Dr. Gifford. Thanks, Mark. We are going to start taking questions, and I'm going to let Mary, our moderator, provide some instructions orders on the call about how to submit your question.
Yes, you can go ahead and type your question in the questions pod on the screen. We ask that you please preface your question with the name of your organization or your outlet. And the questions pod is now open.
Thanks, Mary.
Go ahead and type your question in the questions box.
Okay. Our first question comes from Maggie Flynn with Skilled Nursing News. And Dr. Gifford, I'll probably ask you to start with this one. And she asks, what are some of the specific steps and initiatives AHCA is taking to meet the 75% vaccination goal for staff?
So we have been looking at why staff have not wanted to take it. We've done a couple of polls. We've been doing a number of town hall meetings trying to help improve this. We've done some surveys comparing members who have had high rates and low rates to identify what are the practices that really seem to be working. And what are the reasons staff are not wanting to get the vaccine and how to best address that hesitancy. And so we been all along had a get vaccinated campaign with a lot of material. We're refining that material based on that input and what we've learned. And we're also trying to work with CDC to understand which facilities had lower vaccination rates so we could target our efforts and messaging and resources to them to reach that goal. Those are some of the main ways we're working with that.
Thanks, Dr. Gifford. Our next question comes from Fox News. And Mark and Mark, I'll let you start with this, and then Dr. Gifford, if you want to add as well. Her question is, on March 29th, AHCA, NCAL, and AMDA released a strongly worded statement denouncing the New York directive, and I believe she's referring to the directive on accepting patients, COVID patients from hospitals, and that we specifically referred to a short-term and short-sighted solution that would only add to the surge in COVID-19 patients. Warned that we were deeply concerned with the directive. We urged states to adopt similar policies. A year later, what was the effect of the New York directive? Did it cost lives? And do you think that policy made things worse in New York and any other states? Do you stand by the March 29th warning?
Yeah, we stand by our March 29th warning. And, just to kind of think back where we were a year ago, the country did not know how to manage COVID. We were dealing with a pandemic, with a virus that was very different from what we dealt with before, which is that it was spread by asymptomatic carriers. We didn't have the PPE that we needed to take care of it. And back in March, we had almost no testing. The testing that did exist would take days and sometimes a week or more to get back. And so when the governors were faced with a whole bunch of different decisions as they faced this crisis, they have to make decisions based on incomplete information, and sometimes they make good decisions and sometimes they don't. But we were very active in advising governors on various policies that they should follow. And one thing that seemed clear to us was that it was not a good idea to discharge COVID positive folks from hospitals to every single nursing home. We felt like there were some nursing homes that could manage it, either because they had a bunch of PPE, because they had access to testing, and or because they had COVID specific wings or units. And so we encourage governors to, if they wanted to require nursing homes to accept patients, just limit it to the nursing homes that had the resources that they needed to do so. We think that the governors in every state follow that advice, with the exception of New York. And so it's been well documented that for a period of time in New York, COVID positive folks coming out of hospitals were going into every single nursing home, whether the nursing home had the resources or not to manage the situation. And although it's impossible to know exactly what the results of that were, it's very clear that once you have folks in a congregate setting, particularly when they don't have the PPE to prevent the spread of the virus, that the virus will spread. So it's a logical assumption to believe that that policy in New York led to the spread of the virus. I think the important thing now is, what do we do going forward? What we learned in March and April was that if you don't prioritize people that live in nursing homes, if you don't show the dignity to these people that they deserve, that you're going to have tragic consequences. We didn't have the PPE. We didn't have the testing. We weren't made a priority as these people should have been, and tens of thousands of them died unnecessarily. Now we know that mistake, and let's not make it again. And I think one of the great things about this vaccination program has been that the policymakers have said, you know what, we screwed up. We didn't place these people at the priority level that we should have, and we're not going to make the same mistake again. So the residents and the staff have finally been given the priority that they deserve. And what we're asking for today, the most important message from today is, let's continue that priority. Let's continue to show them the respect and the dignity that they deserve by continuing to focus on this vaccination program, even though we're done with the first wave of it. Let's not fall back to the mistakes that we were making in March. Let's continue to place them at the absolute top priority and make sure that the doses of vaccine are out there when they need them.
Great. Thanks, Mark. Our next question comes from Kim with McKnight Senior Living. And Mark, I'll turn to you for this one. The latest COVID relief bill does not appear to address senior living or the provider relief fund. What will your next step be in moving to address this at a federal or state level?
We appreciate that, and we are disappointed that in the entire $1.9 trillion package, there isn't any money directly for healthcare providers and specifically for long-term care. There are, however, still two avenues that we're working towards, and one is that there is still money left in the provider relief fund. There's somewhere around $25 billion or so, and we are advocating and encouraging the new administration to continue to provide funds for long-term care. This is true both on the skilled nursing side. It's also true on the assisted living side, which has received very little help from the federal government so far. The second avenue that is out there is help from the states. One thing that is in the $1.9 trillion package is $350 billion for state and local governments. About $200 billion of that will go directly to the state governments. And we are really encouraging the state governments to take a very close look at this Medicaid situation in their states and provide assistance, not just to long-term care providers, but all providers that have been adversely affected by the recession that's been caused as a result of the COVID crisis. So we're hopeful that the remaining money in the Provider Relief Fund, as well as the additional money that will be provided to the states, will be an avenue of support.
Dr. Gifford, the next question I think will go to you from Whitney Downer with, she's from Indiana, covering for several, I think, papers, publications there. When the CDC reviews its data to determine when or how to reopen nursing homes safely, what sort of benchmarks could they suggest? What sort of containment goals for the facility and or community would you expect?
Well, I think, one of the questions we've learned a lot in the last year on how to prevent the spread of this. I think the big question that's still out there and is how effective is this vaccine at preventing the spread of virus? We know it's incredibly effective at preventing symptoms and people getting sick and being hospitalized. So the question really becomes, is it also preventing spread, and how many people do you need to have done that? And I know CDC is working on those evaluations. We'd want that data, because I think the question is do you tie reopening to some vaccination rate, or do you say anyone who's vaccinated is okay? It doesn't really matter how many people are vaccinated. I think that's sort of the big epidemiologic public health question that's out there. We do see a number of states who are talking about tying it to vaccination rates, but there's really no science as to what that right rate is. So I think we need to base it on data. And so we're trying to look on that. I do think we know enough that it is preventing the serious illness and hospitalizations. All 3 vaccines are doing that. So I certainly think that if there's people are vaccinated, if family members are vaccinated, that there is a reasonableness, particularly if they're not commingling with other residents who haven't been vaccinated or other people, that it would be safe to reopen in that process. So how you restructure the guidance really, I think, depends on how you decide whether it's everyone or you do it targeted. And that is a challenge that they're working through right now.
And Dr. Gifford, the next question comes from McKnight's Clinical Daily. How concerned are you about the potential effects of the gene variants on the progress that has been made so far in nursing homes?
You know, it's definitely something to keep an eye on. Most of the data suggests that the vaccine is pretty effective against the variants. I think the longer we take for everyone to get vaccinated, it just means there's more opportunity for the vaccine to the virus to continue to replicate in people around the country, and new variants arise. I think in any vaccine campaign, it's always worrisome about variants coming out and whether they can affect it. One of the positives of the technology that they're using, the mRNA and DNA technology that Johnson & Johnson and Moderna and Pfizer are using, is that they can manufacture new mRNA targets to the new spike protein and the new variants relatively quickly, and substitute those out for that. We just may need to have booster shots out there, so we can address that relatively quickly. So I think we will be able to battle it, but it's definitely worth keeping an eye on. But it's another reason why people need to get vaccinated at all ages, because the more virus replicates amongst people, even though they may not be seriously ill, it just creates more opportunity for new variants to arise. And then that will affect the elderly. It'll affect the people with chronic diseases. It'll affect the essential healthcare workers, teachers, and everyone else out there.
Well, thanks for that. And I think that is our final question. So Mark, Dr. Gifford, thanks to both of you for your time today. Thanks to all the reporters and other folks that have joined. With that, I think we will wrap up our conference for today.
Thanks, Beth. And I want to thank everybody for covering this.
Thank you.
Ladies and gentlemen, thank you for joining, and you may now disconnect.